Hello, I'm Deirdre Bruno, and I'm from Aspen University's Department of Nursing. I'm here today to talk to you about how to motivate your patients to accept vaccines. In 2000, the United States hit a historic public health goal. They eliminated measles. Now, this is defined as eradication of a virus because there's been no transmission within 12 months. Now, this is no easy feat. This was accomplished in a collaboration of public health providers and family members who wanted to protect their loved ones and their communities. So, in the last decade, we've actually seen a reemergence of this disease, and this is related to under-vaccinated populations. You may wonder why this is important, but it is because measles is by no means a trivial disease. Before the widespread vaccination, the virus caused up to 2 to 3 million deaths each year globally. Also, according to research by doctors Paulus, Martin, and Fauci, in order to obtain herd immunity, up to 93 to 95% of the population needs to be vaccinated. So, how do we regain herd immunity in a vaccine hesitant climate? The choice to vaccinate or not vaccinate has become one of the most hot topics, especially with the recent COVID pandemic. Additionally, we need to overcome the vaccine hesitancy that's gained momentum through social media. And one of those is due to Facebook pages and other campaigns that falsely believe that vaccines are harmful. One of the biggest roles of nursing is collaboration among patients, families, and communities to create the best conditions for manifestation of optimal health and well being. We are in the unique position of spending the most one on one time with the patients. Therefore, each encounter is an opportunity to educate and empower our patients to engage in their own healthcare. Thankfully, we have nursing models which can guide us in implementing changes. Take Pender's healthcare promotion theory, for instance. It was developed to help nurses understand the main contributors of healthcare behaviors and to encourage healthier lifestyles. The model places the focus on the patient, directing nurses to identify and attempt to address variables in the health behaviors to promote a positive change. Now let's look at the reasons behind vaccine hesitancy. Failure to vaccinate stems too often from misconceptions about vaccine safety, especially those resulting from a now debunked claim that posited a connection between vaccine and autism. Now, this myth was popularized in 1999 when Andrew Wakefield published a paper in the Lancet journal linking MMR vaccine to autism. Now, note, I said Andrew Wakefield. I did not say Dr. Andrew Wakefield. And that's because after it was discovered he tampered with the results of the experiments, um, which, by the way, only had 12 participants, his medical license was revoked and the paper was retracted. In the long run, it hasn't mattered that Wakefield was disgraced or that his paper was discredited because the fear is stuck in the people's minds and it's been propagated through social media groups. They each have their own harrowing account of their child going in for vaccines and shortly after coming down with autism diagnosis. Now, Dr. Peter Hotez and the Global Advisory Committee for Vaccine Safety report scientific evidence proves there's no link between measles vaccines and autism. There is a false correlation which occurs because children are not usually diagnosed with autism until age 2 to 3. Now, this is the same time the second dose of measles, mumps, and rubella vaccines are due. In fact, a Danish study by Dr. Hived and his associates involved 657,461 children to see if there was any truth to the vaccine myth. During the follow-up, 6,517 children were diagnosed with autism. The chances of developing autism were the same in children who received the MMR vaccine and those who did not. So let's look at the two studies again. Andrew Wakefield's research had 12 children participating. The Danish study had 657,461 children participating. Out of the subjects in the Danish report, only 6,517 developed the autism. Again, there was no difference between the number of diagnoses in unvaccinated children versus the vaccinated children. So providing patients with facts and reliable resources allows them to engage in their health care. It's important to know how measles is transmitted and why it's so contagious. Did you know measles is mainly transmitted through respiratory drops and the small particles can remain in the air for up to 2 hours? An unvaccinated person has a 90% chance of contracting measles, and each person with measles may go on to infect 9 to 18 others in a susceptible population. The virus symptoms can begin as a mild cold, sore throat, runny nose, cough, conjunctivitis. Then a high fever develops, anywhere from 103 to 104 degrees, fatigue, and then a rash develops. A person with measles can spread the virus for others for about 8 days, starting 4 days before the rash appears and 4 days after. Now imagine how many people can be infected with international travel. Now that's just talking about international travel. Think of all the parents who take their children out thinking they have a mild cold, so they take them to the grocery store, they take them to daycare, they take them out and about with them to family members' homes. Think of all the people that could be exposed if they are not vaccinated. Now, more serious complications are blindness, pneumonia, and encephalitis. Now, pneumonia and encephalitis can actually lead to death. But overall, the greatest risk of measles-related complications occurs in people who are immunocompromised. Remember, measles spreads easily and can be serious and even fatal. The disease still kills more than 200,000 people each year, and mainly children. Obtaining herd immunity is our best defense against measles. Ethically, we need to be aware of religious exemptions and underlying healthcare problems which prevent vaccination. So let's look at how vaccines work. They essentially build a stockpile of weapons for your immune system that you can use as needed. When you get a viral infection, it usually takes days or weeks for your body to fight back at full force. By then, it could be too late. When you're pre-immunized, the body's defenses are pre-trained to recognize and defeat specific enemies. Each person vaccinated not only protects themselves, but those who are unable to vaccinate. Now, reflecting on healthcare promotion theory, patients will feel good about the fact that their health is improving and that they're protecting others. So remember, each encounter is an opportunity to ask about immunization status and educate your patients. Also, follow-up calls to remind people of upcoming vaccines or missed vaccinations is also effective. There was another in-depth research project completed by Dr. Elles-Murphy and his colleagues, concluded in community outreach and engagement improved vaccination rates in under-vaccinated populations. So this study was conducted in Saskatchewan, Canada. There was a very large rural area with a Indian reservation. Now, the indigenous people there have a habit of traveling between the rural and urban areas. And as they move back and forth between tribal lands and the regular city areas, their vaccine records are getting missed. And so there's like a huge gap there of under vaccinated population. So the research study focused on putting healthcare providers out into the community and specifically tracking people that did not have vaccines yet. Either they weren't able to reach them, they had missed them because of travel, or there was some hesitancy there. Just that one on one interaction and then the improvement in the record taking, they saw a very significant increase in the number of vaccination rates. So, therefore, we do see with healthcare interaction, um, going out and actually speaking to the people and talking them through what they are hesitant about getting the vaccines for, we can help them overcome those fears and those barriers. So, how would we do this in the facility? First, we have vaccine administrations tracked in computerized medical records. Um, Once a month, a quality improvement committee should meet to discuss obstacles which enable the vaccine acceptance or obstacles and enablers of the vaccine acceptance. At the end of the year, surveys will be handed out and the nurses can decide what needs to be changed, what modifications need to be made to improve that program. What are the strengths? What are the weaknesses? The results will then be evaluated, and if the project is shown to have a positive patient outcome, it can be disseminated to other floors for replication and implementation. Thank you so much for your time.